Hello, and welcome to the SADS Foundation's second Heart of the Matter session. I'm delighted to be with you. I'm Michael Ackerman. I'm the president of the SADS Foundation and the director of Mayo Clinic's Genetic Heart Rhythm Long QT Syndrome Clinic and the Windland Smith Rice Sudden Death Genomics Laboratory. We kicked this off a month or so ago in Florida, and thanks to a great question from Dan Alatorre, and we have really enjoyed at the SADS Foundation receiving your questions. Please continue to send them to us, and we will try to get together with you as often as we can. This question is, I've got a negative genetic test. Now what do I do? Should I be retested? What does that mean? Does it mean I don't have the disease? This is a great question, and I thank you for it, and it brings up some very important issues that you, the patient and the family, and your physician need to have a clear understanding of. Importantly, and perhaps most importantly, a negative genetic test does not by itself mean that you do not have the disease for which the physician ordered the test for. It doesn't rule out long QT syndrome or Brugada syndrome or any of the other genetic heart rhythm diseases. What we know in 2012 is that if you truly had long QT syndrome, today's genetic test would give us a positive test result about 75 to 80% of the time. Other genetic heart rhythm diseases, it's much lower. For example, short QT syndrome. The genetic test for short QT syndrome is positive only about 20% of the time or so. Brugada syndrome, it's about 30%. And CPVT, it's about 60%. So if I'm taking care of a patient where I have no doubt that you have long QT syndrome on clinical grounds, and I get a negative genetic test, I am not rethinking my diagnosis, because I know that I should be taking care of about 20 to 25% of my long QT patients with genetically elusive status, or what we call genotype negative, or at least genotype negative in 2012. What does it mean if you're one of those who has a negative genetic test, but I or your physician still think that you have long QT syndrome? It just means that we will have to take care of you and guide our therapy and suggest your risk based upon all of the other clinical components that we have been using for years and decades. It also means that we'll have to make a determination about the status of your family members without the aid of a genetic test result that might say, yes you do, no you don't, yes you do. So it just means we'll have to take care of you the way we've been taking care of long QT patients ever since the disease was known, without the assistance of a genetic test result to guide your risk prediction, to guide your therapy, and to guide the determination of the status of your family members. There will be times where a negative genetic test result, when the story was inconclusive to begin with, can potentially begin to mount a reconsideration for the disease or call for a repeat evaluation of the disease. Did you truly have a phenotype, meaning enough clinical evidence to warrant the rendering of the diagnosis in the first place? We know that this condition and many of these conditions are both underdiagnosed in the United States and throughout the world, but they are also overdiagnosed. So it depends on what is the setting for which the genetic test was initiated in the first place. Then quickly to the question of, should I be retested and when? Great question. Moving target. Basically, that's up to you and your physician continuing to monitor what's the landscape. What new disease genes have been discovered since you were last tested? How much of that disease does that new mechanism explain? If the next new long QT syndrome disease gene explains only un poquito of the disease, less than 1%, not worth it being retested. But maybe someday we'll find a big hit that accounts for 10% of the disease that has not yet been incorporated into the current generation test. Then, and in that setting, maybe it would be worth considering retesting. We have lots to do together. We have lots of disease genes to be discovered, and we have lots of work to do to make sure we understand what is the significance of not only a positive genetic test, but also a negative genetic test. So thanks so much for that question, and we sure look forward to being with you again next time at Heart of the Matter, Ask Dr. Mike. Have a great day.